Do you know if you have a diastasis recti? Well, what is that? That is actually the separation of your rectus abdominis muscles. So if you think about those six-pack abs right down the center, they're connected by connective tissue right down the center through the umbilicus. And during pregnancy, that opens up and splits apart. But after the baby is delivered, that should start to come back together. And a lot of times it doesn't, and we need to enlist a physical therapist to help you with that. I've been treating diastasis recti for a very long time, and I found that it's very helpful to do certain exercises, which we'll get into in a little bit. But first of all, here's how you check if you have a diastasis recti. So to check for a diastasis rectus, what we're going to do is we're going to have you start laying down flat. Then you're going to lift your arms up a couple inches above the ground or above the bed. And now you're going to lift your head up, but try to keep your shoulders down on the table. Okay? And what we're going to do is we're going to find right in the center if there's any space between the rectus abdominis muscles. And right here, we're finding that there's really no space at all. So we do not have a diastasis rectus here. We want to check all the way from the base of the sternum, called the xiphoid process, all the way down to the umbilicus. This is often an area where we have a diastasis. Right here we have a one-finger diastasis, meaning I can put one finger between the two abdominal muscles. As we work our way down, that starts to close and we really have no space between. So here, this is not clinically significant. If we have 2 fingers or greater, that's where we have some clinical significance, where we need to start intervening and strengthening and mobilizing tight tissue in order to get this to close better. Go ahead and lay back down. 2 exercises that I found to be a really great start in helping a diastasis rectus abdominis heal is 1, stretching the back fascia and the muscles of the back. So if we have tightness in this musculature, which can often happen in pregnancy, postpartum, these muscles are working really hard. If they're overactive or there's tension within the fascial system, that can be pulling the muscles in the front apart further. So child's pose is a really great place to start. So you're going to start by laying in this position with your knees underneath your abdomen. And in this position, we're just going to breathe in and out, really trying to maximize the exhale. And feel this area open up and stretch. We can then have you walk your arms over to the right side of the table or your mat, and then you'll get a stretch on the left side. And do a few deep breaths there, and then walk your arms over to the left. This will help loosen up the tissues in the back of you to help the front of you come back together and just work a little bit better. Next, what we want to do is we want to work your transverse abdominis, which is the muscle that is deep to the rectus abdominis. We need to make sure that that muscle is working optimally to help bring some stability across the center line. So what we're going to do for that is we're going to start by lying in this hook lying position. We'll take an inhale to repair. On the exhale, we'll draw our lower abdominals up and in as you float the right leg up and back down. And we'll do the other leg here. Same manner, exhale, lift the leg and back down. What we're watching for is in the center. We want to make sure that there's no doming or peaking in the center. As long as we're getting some scooping, exhaling type motion as she lifts and lowers the leg, we're exercising the transverse abdominis muscle. Okay? From there, we need to also bring in your rectus abdominis. Okay? So we need to get those 2 muscles working together to help bring stability to the center. So in order to do that, we have to lift the head. So we'll take your arms behind your head. All right? And we'll start with your head down. We'll take an inhale to prepare. And on the exhale, you're going to go ahead and draw these muscles up. Let these ribs come down as you lift your head up. Good. We're holding this position like she has an egg between her chin and her chest. Now holding here, we'll do the same marching. Inhale to prepare. Exhale, bring the leg up. She's got a nice scoop here. Ribs are staying in this nice position where they're stabilized over her pelvis. And then one more here. And this will help kick in her rectus abdominis in addition to her transverse abdominis. So there are a lot of factors that can be a reason as to why this diastasis rectus is not healing well. Back tightness, fascial tightness, some incoordination of the abdominal wall. This is just a place to start. There's no recipe, there's no kind of cookie cutter system that will help every individual. So getting a practitioner involved who has experience with diastasis recti can be really helpful to you.